Well, thank you everyone for joining here today. This is Michelle Rich from the Iowa After School Alliance. We're pleased today to have Jami Haberl of the Iowa Department of Public Health here to speak about the Healthiest State Initiative and in particular the 5210 Healthy Choices Framework. Before we get started, I just have a few updates from the Iowa After School Alliance. We would encourage everyone, excuse me, to start registering for the Impact After School Conference. We like to know ahead of time who's going to be there. So take a look at our agenda, which is almost finalized. I think we're going to be able to finalize here within the next week. To check out our sessions and to register yourself and your staff. If you need a hotel room, please get in contact with the Ramada. We've got state rate rooms available if you need that. And just expect more communications over the next month on Impact. For those that are directors, there is a directors meeting on Wednesday that I wanted to make you aware of. And it's required that yourself and some of your staff at least attend the conference. If you're a director, you must be in attendance at the directors meeting Wednesday morning. And then in the afternoon, we have a poverty simulation for our pre-conference. So we hope that, especially if you're going to be at the directors meeting, that you are able to stay and participate in the pre-conference. But other than that, we have some great sessions, including a longer session on 5210 and a lot on social and emotional learning, which I know is a hot topic right now, and managing behaviors and how to respond to challenging behaviors. We've got sessions on literacy and STEM, some great sessions on ag from the Ag Literacy Foundation, and just some others on partnerships and some quality programming sessions. So we hope that you can join us. Take a look at the 21st Century website for more information and to access the workshop descriptions and the agenda. Today, we are focusing on 5210 Healthy Choices Framework. And I'll let Jami go into the details around that framework, but I really would encourage you to take a deeper look at 5210 and how you can integrate this framework into your programming. It's a really easy, great way to remember the really important healthy choices around physical activity and beverages and food, and also related to screen time. So today we're pleased to have Jami Haberl of the Iowa Department of Public Health. I'll turn it over to her to talk about Healthiest State Initiative and 5210. Thanks, Jami, for being here.
Yeah, thanks, Michelle, for inviting me and for giving me the opportunity to share more about some of the efforts we have going on across the state of Iowa, including our 5210 Healthy Choices Count. So I'm going to just kind of step back and give you a little bit of background about the Healthiest State Initiative, just so you kind of understand what the role of the Healthiest State Initiative is in all of the different partners we're working on to achieve our vision. So the Healthiest State Initiative, we were launched back in 2011 through a public-private collaboration to make Iowa the healthiest state in the nation. So we are actually a 501c3 nonprofit organization. We are funded by private investors as well as a number of in-kind investors that support our work. So we actually don't receive any state funding for any of the efforts that we have underway, but we have a lot of partners in government that are key to making sure that we become the healthiest state in the nation. We recognize that both public and private entities are going to be key to making sure that we actually reach that vision to become the healthiest state. So this is kind of our purpose, to become the healthiest state in the nation by improving physical, social, and emotional well-being of Iowans. We are really looking at what are the whole person, that it isn't just about the physical component that we often all think about when we think about health, but really social and emotional does tie into our overall health and wellness, and that we need to be focusing on those as well. So these are our goals: move more, eat well, and feel better. And the feel better really kind of encompasses that social and emotional well-being, and obviously move more and eat well are pretty evident as to what they address: physical activity and nutrition. So why is this important to Iowa? And the information I'm going to provide to you in terms of the stats probably isn't anything that you're unaware of, I'm guessing, but we continue to see a rise in obesity in the state of Iowa. We are now one of the fourth most obese in the state when it comes to our adults, so over 18, which I don't have that slide here, but I think just recognizing that our children are also starting to see an increase in our rates of obesity. And so this map here shows from 2016 where Iowa sits, where our 10 to 17-year-olds, we have a 25 to 29% obesity rate here in the state of Iowa, which has continued to increase over time. When we look at our younger kids, we also continue to see an increase in obesity. Thankfully, we have started to see somewhat of a leveling off, but we do have 15% of our children who are ages 2 to 4 that are classified as obese. So obviously that's very concerning when you start looking at the future of the state of Iowa. Obviously medical costs, that burden that is placed on whether it's the state or whether it's employers. We know that if we have healthy individuals, we have a healthy economy, we have healthy communities, and we have healthy individuals. And so we really need to make sure that Iowans are living their best life, and that we don't continue to see a rise in obesity, which often leads to a number of chronic diseases as well. So right here, I think one of the most outstanding statistics that I've seen is that actually, I think a lot of us think of childhood and we think of asthma being probably the most prevalent chronic disease in childhood, and that's actually not the case. Obesity actually is the most prevalent chronic disease in childhood, which is pretty heart-wrenching when you think about kids that are dealing with obesity and all of the chronic diseases that often are interrelated with obesity. And we also know that it's a very complex disease condition. So it's not something as simple as, changing one or two habits, but we also know that we need to teach kids healthy habits starting at a very young age so that they can continue to take those habits with them into adulthood. So this really has led to 5210 Healthy Choices Count. So in the state of Maine, about 12 years ago, they identified that their childhood obesity rates were rising at a rapid rate and that they needed to do something to stop it. Really, looking at, okay, what does this mean for the future of their own state? If kids are obese at a young age, they're going to more than likely carry that into adulthood, which has just a ripple effect on the society as a whole. And so they launched and created 5210 Healthy Choices Count. And they've been very open to sharing that message and the evidence that is behind the message with other states to adopt. It's actually in a number of states throughout the United States as well as internationally because of the evidence-based strategies that sit behind 5210 Healthy Choices Count. So this is what it is. It's a nationally recognized and evidence-based prevention framework to prevent childhood obesity. It really works to share that consistent message. I think, when we look at health, it can be very confusing and complicated for a lot of people. There's a lot of mixed messages out there. There's a lot of misinformation out there for individuals to understand, like, what should I be doing? What shouldn't I be doing? And so this really provides some of those clear goals for those kids and families to live healthy every day and the framework to take action. It's for schools, early care, after school programs, and healthcare, really to look at programs, policies, environments, and how they can be changed to support a healthy choice. I think what's really important that 5210 is not meant to replace other local efforts and programs. It's really meant to provide that common overarching message that will help tie them together in the community across the state as well. So you probably already have a lot of programs that, tie into healthy eating or drinking more water or reducing those screen time. So this isn't to replace those by any means. I don't really call 5210 a program, but it's really more of an initiative, and it's a common message that all of us can get around. And hopefully, the more places we see it, the more that kids will start to say, just like when they see commercials about McDonald's as an example, right? We don't have a budget that McDonald's has, but can we start to have 5210 messaging in places where kids are today that they can start to say, hey, I saw that, or mom or dad, can you help me? I'd like to have more fruits and vegetables. We know kids can influence parents as much as parents can influence kids. And so really trying to have that common message in multiple sectors within a community and where a kid resides. So it really is two-pronged approach. It's the health messaging campaign, so making sure that we all have the message that can be shared, but it also provides training resources and tools to help implement and as well as sustain some of those wellness strategies. And so I'll talk about some of the resources that are available and really go through the steps of how you can get engaged, and you can start small and work up big. I think one of the things we often here in Iowa, we want to, jump all in and we want to do it all at once. And that's, great if you can make that happen, but often we fail when we try to do that. And so how can we take small steps that are going to lead to bigger impacts? So the 5210 really focuses on 10 strategies of success. And I would say the top 5 strategies are really where within the after school programs that you can start to change policies, systems, or environment. So what are things that you can do to help limit unhealthy choices for snacks and celebrations? So instead of having cake and cookies every afternoon, can you switch it up and actually provide some healthier choices for kids? So, maybe it's fruits and vegetables, so that those kids actually have the appropriate energy that they need versus, filled up with lots of sugar that often causes behavioral issues, learning challenges, and then also causes them to crash. So these 10 strategies of success are really kind of what we focus on around 5210. And then there are specific, what I call kind of policies that can support the different ways to limit, whether it's recreation, screen time, snacks, sugary drinks, those type of things. So this is our focus. Obviously, there's other 6 through 10 are other opportunities and are done in different ways based on kind of the setting that we're dealing with. So schools obviously are very different than after school programs, which are different than early care programs. So I'll talk about some of those resources shortly. So we're just getting ready. Actually, we're going to launch later this week a new action guide that is aimed for education, early care, and after-school programs that really tries to outline the 5-step process. So you're getting a sneak peek of this before we actually launch it on Thursday. So this is really, we tried to simplify what is the opportunity and how can we best help organizations that work with children every single day to be part of 5210 and to incorporate the message. And so we'd love your feedback. Don't think this is easy because this is really what we want. We want to make it easy for all of our partners across the state to implement this. So I'm going to go through each of these steps for us. So engage. So really the first step is, whether it's, regardless of what setting you are in, whether you're in a school setting, an early care, or a after school program, is really identifying a champion, but then identifying team members. So are there other team members that you work with either currently or maybe would have interest in trying to make changes within the setting that supports healthy choices? Obviously in some, for a daycare, at a stay-home daycare, or in-home daycare, there may only be one person. So you may not have a team, which is okay, like as long as that person can be the champion. It also can be an existing team. So maybe already within your after-school program, you have a wellness committee or you have a leadership team that already exists. So it's great to get another team or another, group of individuals. It's really looking at what do you currently have, and if you have something, can you incorporate the conversation of 5210 into that current team? So the first step really is engage, kind of gather the team, the leaders around you to say, what can we do within the setting to adopt 5210? Step 2 is register. And so we have the opportunity for sites across the state of Iowa to register to become a 5210 register site. It's simple, it's easy, it's free, and it doesn't cost anything. So part of this is giving us a statewide understanding of sites that are incorporating 5210, which is great, but also helps us get feedback from individuals that are participating, and it helps us gather some data as to what you are doing around the 10 strategies. So when you register, there is a questionnaire of questions that you would just answer yes or no to. And please, our expectation is that you do not answer yes to all of those because we recognize that probably a lot of places in the state of Iowa would not be able to answer yes, and that is okay. So we've had some sites, concerned that, oh my gosh, I didn't answer yes to a majority of them. That's okay. This is helping us understand the baseline. Where do we sit today when it comes to implementing some of those strategies, and gives us the opportunity to look at where we can go in the future and obviously start to make some of those changes. By becoming a registered site, you receive, at the bottom of the screen, you see a Healthy Choices Count registered site site photo, that is actually a window cling that then you can put up at your facility to be recognized locally that you're a registered site. We also then have on our website a map of the state of Iowa, and you can click on the county. You can see where the registered sites exist within your community or within the county itself. So our goal is obviously to reach as many sites across the state of Iowa so that we fill that map up so it's fully green. Step 3 is then, the hard work, as I always say, to implement, so identify what your goals are and turn them into action. So in this action plan, we put together kind of a template, like based on, what are your goals? What are the steps that you need to take to reach those goals? And who's responsible? Do you need a funding or a partner to assist with that? What is the due date? So really helping you outline and implement some of those strategies. Again, start small. You may start with just one strategy. Maybe you just want to implement a celebration policy that really starts to look at how do we reduce the number of sugary type of food items that we have available to our kids during the after school program. So it could be one small thing. Don't make this more complicated, I guess, than it needs to be. So one of the things that when you go through the survey and the questions that you answer, yes or no, you can use that as kind of your baseline to say, okay, we said yes to, trying to think of a good example. We said yes to that we have a celebration policy, but we said no to something tied to physical activity. So maybe we want to prioritize our time and energy around doing something to improve more physical activity with our kids. So that survey kind of gives you some ideas as to things that you could be working on, but you could have other things that aren't specifically called out in that survey that is important to you that ties back to healthy choices for your kids. So identify your goals and really turn them into action. That's the key. So here are some of just the things that have been done throughout the state of Iowa. And we have other information on our website that can show best practices. So we've had some facilities put in drinking fountains, those refillable drinking fountains. So it's a lot easier to fill up your water bottle when you have the refillable stations versus those lovely drinking faucets that are much more challenging to get your water bottle filled up. Incorporating some just brain breaks and physical activities within the classroom or within the program that you're incorporating. We had a community build a greenhouse so that they could actually provide fresh fruits and vegetables to their program year round. So there's lots of different ways that you can incorporate, and we have lots of great, I would say, examples across the state of Iowa. So if there's things that you're specifically looking for that we can help connect you with some of those other communities or programs that have done stuff, we're happy to do that. So we're starting to see more action around this across the state of Iowa over the last 2 years since launching the Healthy Choices Count. So step 4 is the share. So this is really important. I think one of the things that most Iowans, we are very humble and we don't like to brag about some of the great things that we're doing in our community, but it's really important that we do share and spread the word about all the wonderful things that you are doing today. So we encourage people to use social media. We also have, for any site that is interested across the state of Iowa, you can actually order at no cost. It's free. You can order posters that can be put up in your facility. So on the bottom right-hand corner, you can see there's a poster, a picture of a poster. You can order that, as we have 2 different types of posters. You can order those. Those are available at no cost. We also provide a monthly feature that gives tips and tools of like how you can incorporate 5210 within your organization. And so that comes out at the beginning of every single month. So the April 1 will be released here soon. We also, for registered sites, are giving a monthly newsletter that also provides additional tips beyond just the feature and connects you back to other resources that might be available, as well as any funding opportunities that we become aware of that could help support implementation of 5210 as well. So spreading the words, we use Healthy Choices Count as kind of our hashtag to help us kind of spread the word across the state of Iowa. And we would love to know the stuff that you guys are doing already that kind of supports the work of 5210 here in the state. And the final step is to check in. And so one of the things that we've really tried to do is bridge together the opportunity. So the Healthiest State has offered a annual award for the last 2 years tied to education systems that are doing things that support healthy choices. And so we're actually kind of blending the work of 5210 into this new annual award. So the check-in is required every September to recertify your school early care or child care or out of school setting. And then you can be awarded a bronze, silver, or gold recognition. Any of the, if you reach a silver or higher, you have the opportunity then to be invited to apply for the Healthiest State Award, which the award itself is a cash award as well as recognition. And so Irving Elementary School in Waterloo, as an example, won the 2019 annual award, and they received a $5,000 award so that they could continue to do the great work that they're doing. We also recognize all sites in the state of Iowa that have implemented and registered 5210 at the annual awards ceremony, just as recognized for the opportunity. We want to recognize people for doing great things. So we know that this work isn't easy, that you guys are being pulled in 100 different directions, but we also know that it's really important that we recognize the great work that you are doing to help us ensure that we have healthy kids today and into the future. So that's kind of the final step of checking in, is making sure that we have an annual kind of update as to where we're at with the survey so that we can continue to demonstrate the progress that we're making here in the state of Iowa, not only with our funders, but also with state legislators, the governor's office, and other partners that are interested in making sure that we have healthy kids in the future. So that's kind of our 5-step program. I'll go back to this slide. It's kind of the 5-step process. So, step 1 is really to engage. So find that champion or find your team, register. It's simple, it's easy. Go to iowahealthieststate.com/5210, and you can click on out of school programs, and you can get registered today. Implement, that's where the rubber meets the road, as I always say. That's where you can start to put together your action plan and start to identify what is the first step that you can take to help support healthy choices for your kids. And then obviously sharing those great things that you are doing today and into the future, continue to share those. And then that annual check-in. So every September you'll be sent an email reminding you to complete the survey again so that we can continue to see the progress that you're making and continue to share the great success from across the state of Iowa. So that's a 5-step process. I'll end it with this slide kind of, I guess, that has how you can connect with us. A lot of the materials that the Healthiest State shares is really tied back to 5210. And so we have a monthly newsletter, and I can share the link with Michelle as how you can get signed up for that, so you can receive that monthly newsletter. When you become a registered site, you will be automatically added to a monthly email that gives you more tips and tools for 5210. And like I said, that also provides you any funding opportunities that we learn of that could be useful for you as you start to implement and make changes within the after school program that you manage. So I'm happy to answer any questions or take any comments or thoughts or feedback from anyone that's put on the call.
For those that have questions, you can either type in the chat or unmute your line and ask a question. In the meantime, I'd like to thank Jami for this information. And I'm wondering, of those that are on today, did anything really catch your attention, or is there anything that you can think of right now that you're looking to tweak a little bit based on the 5210 framework? Well, I think one natural part of your program that you might want to reconsider, although I know it's rather difficult, is the reward dinners. I know that a lot of programs do a pizza party for reward, but maybe we could look at incorporating healthier choices along with the pizza and start moving away from something unhealthy like that. So that's just one example, but I hope that this presentation got you thinking about some other areas that you could help improve the the health and wellness of youth and families of your program. And I will just reiterate from Jami's comments that, remember, kids can often be influencers of their parents too. So think about how you're supporting youth and how they then communicate what they're doing in your program to their parents or family members back home, and how they might be able to influence some really pervasive choices in the home too. So you have a lot of influence over youth in your program when they're there, and also when they get home. So I want to thank everyone for joining us here today. I'll follow up with Jami with resources, and if you have any questions, I know that Jami would be happy to answer those, but please get a hold of us as well at the Iowa After School Alliance. And if you just want to talk through some changes that you might be thinking of making based on 5210 or any other framework, please let us know. We're happy to talk through that. Thank you, everyone, for joining us here today. Like usual, I will post resources on the 21st Century website along with this recording. Have a great day, and I look forward to seeing everyone at Impact at the end of April. Bye, everyone.
Thank you.